Hello, everyone. Welcome to the virtual McMaster Museum of Art. My name is Carol Pottedmorney, and I'm the Director and Chief Curator at the museum. We are pleased that you have chosen to join us for the Immune Nations webinar series. As we gather, we are reminded that the museum is situated on land that is the traditional home of the Haudenosaunee and Mississauga peoples. We recognize and deeply appreciate their historic connection to this place. We also recognize the contributions Indigenous peoples have made in shaping and strengthening this community. We are grateful for the opportunity to meet here and reaffirm our collective commitment to make the promise and the challenge of truth and reconciliation real in our community. You may have noticed that we have sign language interpretation available for this webinar. So before we begin, I would like to introduce two ASL interpreters here with us today. Diane Diendrade and Jody Morrison. Thank you, Diane and Jody, for being here and for your time today. The Immune Nations exhibition is co-led by Natalie Lovelace with Stephen Hoffman and Sean Caulfield. The exhibition explores complex issues related to the use and distribution of vaccines in the world today and the capacity of artistic research to solicit complex forms of active engagement when dealing with difficult and divisive social and political topics such as vaccination. Today's panel explores the impact of misinformation on vaccination, as well as the ways of countering the negative impacts of misinformation in relation to public health. In terms of exhibition programming, there are a total of 3 panels in our webinar series, the session today being the final in the series. If you are interested in the previous sessions, all of the recordings will be available on the Immune Nations website, as well as the McMaster Museum of Art's YouTube channel. All of the panels have been supported significantly by a grant from the Natural Sciences and Engineering Research Council of Canada. In terms of housekeeping, for today's panel, we have a 45-minute roundtable discussion, then a 30-minute open chat or Q&A, and a brief closing provided by Sean. Please load your questions into the Q&A function at the bottom of the screen. You can load them throughout the event, and they will be brought to Sean either individually or grouped thematically, and he will bring them to the panel for response. So I'd like to welcome our visitors, and I'd like to welcome Sean Caulfield, professor at the University of Alberta, a project lead for Immune Nations, and a contributing artist to the exhibition. I will hand it over to him to introduce the panelists and start our panel.
Great, thanks very much for that introduction, and it's great to be here today. As was noted, I'm a professor in the Department of Art and Design, and I'm speaking to you from Treaty 6 territory in Edmonton. And I'm really excited to get into this topic. It's a difficult topic, but I think an important one for us to explore today. I'll just emphasize, since we have 2 ASL interpreters, please try everyone to speak slowly as we get through our discussion today. We had originally planned to have Dr. Theresa Tam with us today as a panelist. However, given the current uncertainties around the COVID pandemic, Dr. Tam was called away at the last minute and unfortunately cannot make today's discussion. However, we have 2 great new panelists who kindly agreed to step in at the last minute. The first is Susan Rogers Van Katwyk. Susan is a managing director of the World Health Organization Collaborating Center on Global Governance of Antimicrobial Resistance at York University. Susan's research focuses on strengthening the scientific evidence base to generate actionable policy recommendations for global health threats that require collective action. Susan also has a substantial experience directly engaging in policy process, working with several national governments and UN agencies. We're also hoping Dr. Susy Hota will join us. Dr. Susy Hota is an associate professor of medicine in the Division of Infectious Diseases at the University of Toronto and is the medical director of infection prevention and control at the University Health Network in Toronto. During the COVID-19 pandemic, Dr. Hota has played pivotal roles in regional and provincial pandemic responses and has been frequently featured on national media as an expert on health system responses to the pandemic. In addition, we have 3 other panelists with us today. Timothy Caulfield, who is a Canada Research Chair in Health Law and Policy at the University of Alberta. His research on stem cells, genetics, research ethics, and public representations of science and public health policy has led to over 350 published academic articles, as well as 3 books. He has won numerous awards. He is a Fellow of the Royal Society of Canada and the Canadian Academy of Health Sciences. Tim is also a collaborator on this project, and Tim and I have worked together on many projects over the years that bring science and art together. Next, we have Rachelle Viader Knowles. Rachelle. Sorry about that, Rachelle. Rachelle is the head of International for Arts and Humanities and Reader in the Fine Arts at Manchester Metropolitan University, and is also a participant in the Immunations project. Her practice-led research investigates translocality, dialogue as art, and artistic practice methods developed through participation, co-production, and networks. She continues a long-standing collaboration with Armenian artist Mkrtich Tonoyan, who is also a participant in the Immunations project, and they work together on a piece for the exhibition. And finally, David Price, professor and chair of the Department of Family Medicine at McMaster University. Through his leadership roles at the university and hospital and his involvement with local, regional, and provincial government bodies, he has developed expertise in primary care reform and healthcare policy development. Dr. Price has been instrumental in helping to create the academic family health team at McMaster University, an interprofessional team consisting of physicians, nurse practitioners, nurses, social workers, dietitians, pharmacists, and psychiatrists. So that's our panel today. And again, a huge thanks to all of you. I know it's a very busy time. You have a lot of things to attend to, so I really appreciate you taking time to be with us. Very briefly, I did want to acknowledge the hard work of all the panelists, all of the collaborators in the Immunation project, all the artists and various collaborators, and the hard work of my 2 fellow leads, Professors Stephen Hoffman and Natalie Lovelace. I also want to acknowledge the outstanding work of the staff at the McMaster Museum of Art, who have made this exhibition possible and a success. So let's get into the dialogue, the discussion. I guess I would first say, as we are become keenly aware through the COVID-19 pandemic, vaccines raise very complex questions that can be difficult to address through one disciplinary lens. One of the goals of Immunations project was to explore how creative research undertaken through interdisciplinary exchange might help to contribute to addressing some of the complex societal issues raised by vaccines. And of course, one of the most pressing issues in this regard is the impact of fear and misinformation on vaccine uptake, and more broadly on public health policy. So I want to jump in with a very direct question, but one that's also very complex. What impact has misinformation had on vaccine acceptance, and particularly in the context of COVID-19? And Tim, maybe I'll start with you, because I know this is an area of focus for you.
Yeah, thanks, Sean. First of all, it's an honor to be here. Really appreciate the opportunity to talk about this really important topic. And Sean, you're right. There is absolutely no doubt that misinformation is having a dramatic impact. In fact, I'm sure everyone's heard this. People say that we're in the middle of an infodemic, and that's so true. And that infodemic, it is freaking people out. It really is having an adverse impact. There's been a lot of interesting studies that have actually tried to put a number on it, traced the impact of misinformation on vaccine uptake. And there just is absolutely no doubt it's playing that role. And we can go further than that. We can start pointing fingers a little bit about where this misinformation is residing. Look, this is mostly, not entirely, but mostly a social media phenomenon. People have been studying misinformation for decades, and people often ask me that, what's different about what's happening right now? I think there are a lot of interesting dimensions to it. Ideology, we can come back to that, I think, is another part of the story. Polarization, that's another part of the story. But it really is a social media phenomenon, in part because social media is a polarization machine, right? This was an interesting study. Look at that stat, 85%. This was a study that came out from the University of Alberta, and they tried to put a number on it. And they found that about 85% of the misinformation that's out there has as its origin story, as its beginning, social media. Now, look, it's hard to study that well methodologically, but we've looked at this from enough methodological directions that I think that number's in the right ballpark. It really is a social media phenomenon. And the other thing that we know, Sean, is that the volume of misinformation is also increasing substantially. This is a study that came out in August, and they found that they were looking at it in the context of the Delta, and they found that misinformation about do the vaccines work increased over 400%. That same study found that misinformation about the idea that there's microchips, right, in the vaccines up over 150%. Misinformation about the idea of infertility and miscarriages up over 75%. So misinformation having a real impact, Sean. Misinformation largely a social media phenomenon, not totally. I think it's important to recognize that it's coming from all over the place. But we also know the volume is increasing. There is good news, and we can come back to this. There's things that we can do. I think there's evidence-based strategies that we can deploy, but absolutely no doubt about it, Sean. Misinformation, one of the great challenges of our time.
Yeah, thanks for that, Tim. Those numbers are quite shocking. And I guess the answer is give up Facebook. Right?
That's right. Well, we can come back to that. Is that the answer? I'm not sure.
Yeah. Before we move on, and I want to direct this question to someone else, I just want to welcome Susy Hota, who joined us. So welcome, Susy. And again, thanks for making time last minute to join us. So it's great to see you. Susan, do you have any thoughts on this particular question that you want to chime in on?
Yeah, thanks, Sean. Glad to be here and to jump in last minute for this panel. I think this is really exciting and really important. For me, I think misinformation does a couple of things. It slows down vaccine uptake at the end of the day, either because folks just refuse to get vaccinated or because they take this kind of wait and see approach. Just put it off and see how it all comes out in the end. And what that ends up doing is kind of undermining our public health campaigns, right? What we want vaccines to protect individuals, but we really want vaccines to protect communities. And the more vaccinated people there are in a community, the more that we can cut off chains of transmission and we can provide protection that sort of wraps around the more vulnerable people in a community. And so misinformation, when it slows that down, when people say that they don't want a vaccine or they want to wait and see how things turn out at the end, that means we can't get those vaccination rates up high enough to really provide the level of protection in the community that we otherwise could. The faster we can get those vaccination rates up, the more protection we can kind of wrap around everybody in the community. And it's not the first time with COVID-19 that vaccine misinformation has led to this kind of hesitancy. You see it sort of every year with annual flu shots. You've seen misinformation about HPV vaccines to protect against cervical cancer. You've seen lots of misinformation about kids' vaccinations and measles, mumps, and rubella. But I think the overwhelming magnitude of misinformation that Tim was alluding to with the COVID-19 vaccinations has made it a really, really pressing issue at the moment. And it's definitely a challenge going forwards.
Yeah, that's great to hear that. And I guess just maybe a quick follow-up question. The COVID pandemic had so much complexity, things changed so quickly. It was difficult for governments to respond sometimes. And, perhaps decisions were made too slowly, perhaps bad decisions were made. How does that kind of dovetail into this problem of this misinformation? Does that make sense as a question, Susan?
It does. One of the things that strikes me about being in the middle of a live pandemic where the science is changing all the time is that we learn more, we try and change the guidelines to adapt to that, and that helps spread more misinformation because all of a sudden we're talking about third doses of vaccines. It's all not fully vaccinated if you haven't had your third dose of vaccines. And so every time there's a bit of a shift in the narrative because we've learned more about the science and there's more that we can now do to protect people and more strategies we can employ, it gives people who maybe don't have the community's best interests at heart, another opportunity to come in and sort of incept a little bit more misinformation into the conversation. And, we're going on 2 years of this pandemic at this point. Even people who were really engaged and really up on their science at the beginning, it's been a long several months, and you just can't keep as up to date all the time. And that's an opportunity for people to sort of not recognize misinformation as it passes them by.
Yeah, so complex, shifting time, right? It's hard to balance things. Maybe I'll just sort of move to the next question. What are some of the sources of misinformation? How is it spread? And sort of where do these beliefs come from? Tim, maybe again, I'll go to you first, and then others for some thoughts.
Yeah, there is clearly no doubt that, as I said before, social media is a huge driver. But that invites the question: what's the motivation, right? Why is this misinformation out there? And it really falls on a continuum, right? There is at one end those individuals and maybe even nation states, right, that have a particular agenda, right, a particular reason for spreading disinformation. So these individuals have intention. They know that what they're spreading isn't true. And sometimes the agenda, Sean, is just to create information chaos, right? That's the agenda, right? They don't really care which direction the wind blows. They just want to create a hurricane of noise, right? And that is, one sort of set of actors. On the other end are is the reality of that most people don't want to spread misinformation. Interesting research by Gordon Pennycook has found that 80%, and his colleagues, David Rand at MIT among them, he has found that most people, over 80% of people, recognize how important it is to be accurate, and they want to be accurate. They don't have a malevolent agenda to spread misinformation. They're just trying to figure out what's best for them and what's best for their families. And they're inadvertently spreading misinformation. Here's more numbers. In fact, this was a study that came out in the United States that found that 95% of Americans now recognize that misinformation is a serious problem. That's pretty. It should be 100%, but that's still a pretty high number, right? And that same study found that most people blame social media for the spread of misinformation. Again, that's accurate. But then look at this number. This was another study. Again, a pretty big, robust one that found that 8 out of 10 Americans believe one of the big COVID conspiracy theories. Sometimes they're just open to the idea, but that's shocking, right? That's shocking. I think it was 79% is what they found. So people recognize that it's a problem, but despite that, you still have this large percentage of population embracing misinformation. And that really highlights, I think, the reality that that even if you recognize it's a problem, you can still spread misinformation. So you have this continuum of sources, and we need to recognize that complexity if we're going to devise responses to it.
Yeah, those are troubling figures. And I'd like to get into how we might respond, but before we do, maybe I'll turn to Susy and David, and maybe Susy, you first. You're jumping in sort of in the middle, but do you have thoughts on this particular?
A few thoughts. I mean, I think really great points that were made earlier by Tim. And, I think with social media, it doesn't help that there are character limits, right? And so statements can get out there that are incomplete and don't have the full context of what we know. And given that things are so rapidly evolving in this pandemic, and we have to be okay with some level of uncertainty, it kind of sets up a situation where it's very easy for things to get misinterpreted or misconstrued, mischaracterized, and then perpetuated and amplified on a level that we've never seen before. And so, I am so mindful of the potential damage that sound bites and headlines that don't match the article and these short, tweets that get out there can have. And until we can kind of encourage people to dig a little deeper and truly understand what issues are. I think this is something we're going to have to struggle with. But another thing too with social media is people aren't necessarily vetted the same way in terms of, you know, who they are and what opinions they could be or should be speaking about. And so who's the expert? And I think that's another source of misinformation is everyone and their dog chiming in on an issue when they may or may not have the expertise or the understanding or knowledge to interpret what it is that they're saying. And, you know, unfortunately, people gain followers according to, you know, how popular their tweets are, and sometimes the language they use that can be very provocative and get attention. And that's not necessarily going to be a source of information that's really that credible. So these are some of the things about social media that really kind of concern me, and the way that we communicate some of these issues in this pandemic to try to get out to wider audiences, but can have some downside. And particularly with, you know, the uncertainties we have to live with in this pandemic, with things changing, with there not being easy answers on what we should be doing at this stage in the pandemic. In particular, as we go further down, everything's in the gray. And so, you know, these individuals can sometimes capitalize on that, you know, the uncertainties, and then amplify, you know, that problem of, well, we just don't know, and introduce doubt into people's minds. And so these are some of the subtle things that happen as well when the wrong people are speaking about things.
Yeah, this is a great point, and it underscores the kind of catch-22. You need to communicate quickly, but this can cause problems because of, yeah. I do have an answer though, and that is everyone should go to art galleries. Look at art. That's the answer. David, do you have any thoughts on this particular?
Yeah, thanks, Sean. And I'll just build a little bit on what Susie and Tim were talking about. It is an evolution in the science, I think. And in your introduction, you introduced me as the chair of our department. I'm actually now the past chair. And I think that's the point, is that things evolve and it's not a big deal. But in this pandemic, in the information has evolved so quickly and so dramatically that it's hard for people to keep up to it. I was in the hospital this morning doing rounds, and at one of the nurses' stations, we had a really good conversation about pediatric vaccines, and just the nurses, all of whom had children between 5 and 11, or many of them did, we're trying to figure out, for sure, am I getting my child vaccinated? But I've heard from another doctor that maybe we should wait. And another one says, yes, we should keep going. And I think there's so many different aspects of this, and it's really not crystal clear. It's not concrete. And to pick up on Susie's point, there is some uncertainty around this. We don't know for sure, for example, what the 10-year impact of having a vaccine is. We can tell you that the science says there shouldn't be any impact. We can say that there's been billions of doses, but you can't unequivocally say there's going to be no impact in 10 years. I mean, most of us think that's highly, highly, highly unlikely, but that seeps into the conversation. And when you have slightly different messages coming from one healthcare professional and another, and then somebody on TV, and the same aspect of those short sound bites. And even when you watch the national news, we get 30 seconds of Susy Hota or 30 seconds of Isaac Bogosh. And when you speak with them on an individual basis, sometimes their answers are much more nuanced and thorough, but you can't do that in the 30-second soundbite. And so, yes, social media is an issue, but I think it's also been a very humanistic conversation as well. And it's friends, people who are scientists are trying to interpret, and everybody has been talking about this. It's the number one conversation. And I just Googled just before we came on COVID vaccine, and Google shows that there are 6.5 billion different items if you just Google COVID vaccine. So it's a huge thing. I mean, there would have been nothing on this 2 years ago. And so the level of information and potential misinformation is huge.
Yeah, these are great points. I want to get us to the actual exhibition soon, Rachelle. You've been on the sidelines, but before we do, I think a good transition might be to just ask the question, what are some things we can do to counter misinformation? How can we kind of, work against this difficult trend? And Again, Tim, maybe I'll start with you and then turn to others, because again, I know this is an area you've done some work in.
Yeah, I think there is, good news. The good news is debunking works. It does work. I know, some people don't like that term debunking. I get it. It sounds unilateral and it sounds combative, and those are both bad things. But that's the term of art that's out there. And the research tells us, the growing body of evidence tells us that countering misinformation, going on social media with engaging, shareable content really can make a difference. And this goes to that tension Susie was talking about, because you want to have content that is scientifically accurate but still shareable, because that's what that research tells us. That's what works the best. And a good example is the FDA FDA tweet about ivermectin. I don't know if you guys saw that. They tweeted about ivermectin and they said, "You're not a horse, you're not a cow. Seriously, all stop it." Some people didn't like it, right? They said that was glib and the FDA shouldn't be doing it. In this era of misinformation, I think we need more content like that, stuff that is scientifically accurate but still shareable. Ottawa Public Health, they also rock. That's a really good example of another institution that makes shareable content. And of course, I want to talk about our initiative, hashtag Science Up First. This is our social media initiative to fight misinformation, again, using shareable content. So part of what you want to do, shareable, accurate content that meets misinformation where it resides, largely social media, not entirely. But in addition to that, of course, you have to have strategies to have those one-on-one conversations. You have to have critical thinking skills, so more in the education stream, media literacy skills. The regulators need to do more. That's Health Canada, FDA, FTC. They need to do more. On the regulators for the health professionals, so the College of Physicians and Surgeons, the licensing boards in the United States, they need to do more to stop their members from spreading misinformation. And of course, we need the social media platforms to do more too. And that's, this is one of the great challenges of our times. But I think that if you look at the body of evidence, it tells us there are strategies that we can deploy that can make a difference. And I think it's important to remind ourselves of that. I can't remember, was it Susan who noted that misinformation has had an impact. It creates this hesitancy, but we also need to celebrate the success stories, right? We went from in Canada, I think at one point it was like 45%, some degree of hesitancy. Numbers in the United States were even bigger. I think UK very similar. And now we're down to like 17%, depending on what jurisdiction you live in. In Alberta, it's more. That's a science communication success story. That's people talking to each other. That's people modeling, getting the vaccines. We can make a difference, right? It's at the tough part now. But if we deploy evidence-based strategies, if we listen, if we're empathetic, we can make a difference. Sorry, I went on too long, Sean, but I'm passionate about this, so I took the opportunity.
That's great. Susan, do you have thoughts on this? And then maybe I'll turn to Rachelle, because I think it's a good transition there.
Yeah, one thing that I've been thinking about as everyone's been talking is that this isn't necessarily the space that everybody was trained to work in, right? I'm an epidemiologist. I was trained to look at nuance and to crunch numbers and to think about all of the ins and outs of a particular situation. And at this point in the pandemic, people want certainty. And as it turns out, people who want to spread misinformation are more than happy to be 100% confident in their recommendation. And as David said, that's not what doctors and scientists typically want to do, because we've looked at all of the ins and outs of things. And that doesn't make the recommendation from the person spreading misinformation better. And it doesn't discount all of the incredible science that has gone into getting us, the vaccines that we have at the moment. It's just, that's not how scientists were trained to communicate. In fact, most scientists aren't trained to communicate, and it makes it really difficult when you get up on panels or you're trying to combat misinformation on Twitter, because that's not exactly in your average scientist's wheelhouse.
Yeah, that's great. And I think a great transition, Rachelle, into our project, Immunations, which I think tried to look at some of these questions through creative practice. And what do you think? What role does art have to play in all this? Yeah.
Yeah, well, thanks so much, Sean, and to everybody for this great conversation. And yes, I think that some of the things that have just been mentioned are a really interesting segue into talking about immunizations, and this project that we've been engaged with for quite a long time now, and it's been an extraordinary journey. And thank you so much to McMaster Museum of Art for hosting the exhibition. A quote that I heard on the radio recently that really struck a chord was by Chris Hobson, for the Chief Executive of NHS Providers here in the UK. And the quote was, "We understand why people are vaccine hesitant. We just need to win the argument." And I think this really resonates with some of the things that you just said, Tim, about the need to talk about this, to keep talking and to have that dialogue and get skin in the game as much as possible. And I think that that's what was so fantastic about the whole process of developing immunizations, as much as it is an exhibition, and McMaster, of course, have hosted the exhibition. It is also, I think, first and foremost about a process of dialogue. And the journey that we've been on in creating the exhibition has had all the way along dialogue so much wrapped around it, dialogue amongst all of the artists, the public health colleagues, the scientists who've been involved in the project, and dialogue, of course, amongst the people who made each of the individual projects. But we've also had all of these kinds of activities as so central to what we've been trying to do. So I think this also talks about with art galleries, we have the art gallery, we have the exhibition, but then we also have the public programming that goes along with it, where we're really trying to talk to communities and get involved in the conversation as this kind of key thing about our role with this particular topic, about contributing to trying to win the argument.
Yeah. Do you want to talk a little bit about your particular attempt at the winning the argument, if you will?
Yeah, absolutely. What I'll actually talk about also is, some of the reflections, because of course, when we started this project, it was pre-pandemic. And I think, we've all been on a journey of reflection on the work that's produced and thinking about, how maybe we might have done things differently had we started this project now, for example. I mean, I think the point about social media was well made, and certainly if I was embarking on the project that I was part of now, I would be thinking a lot more about social media. But the work the project that I led with my colleague Mkrtich Tonoyan was called Vaccinations, and we really worked with students across a number of different countries. And Sean, yourself, you led the project at the University of Alberta with some of your students, and we also had Patrick Mann from Western involved with some of his students, and it was really about taking the big project of immunizations and in a way kind of reflecting that in another project that was particularly working with groups of students, both fine art students and graphic design, and some journalism students as well. So some of the outcomes of that were in the form of posters. We made a big zine that we've had the opportunity to show in Hamilton. We also made window graphics and little zines that were very much about getting information out into the world. And a lot of these, of course, are talking pieces, as I think so many of the works in immunizations are, to trigger that kind of conversation, to get that skin in the game, as it were, and to get these students to start thinking about their role, not just as communicators, but as critical thinkers engaged in this evidence-based activity, to think about what they're communicating, not just the modes of communication as sometimes graphic designers, for example, tend to think about. But one thing I'd like to just put out there, because it's been really a big part of the thinking that I've done recently, is an awareness that one of the colleagues that I worked with as part of the project, I have become aware subsequently, is a little bit vaccine hesitant themselves. And so I think because this project was as much an art project as it was a research project, it's led me to really think about perhaps what we would call a methodological blind spot in the way in which I embarked on my corner of the exhibition, which was really perhaps to go in with an assumption that the people that I was working with were all on board and like-minded, whereas in fact, we can't necessarily always have these assumptions, and we have to be perhaps a bit braver about bringing that conversation to understand everybody's kind of point of view on such topics. So maybe I'll just sort of leave it there and see if you have any further questions.
Yeah, no, I think that's great. And I have a question that I'll direct to you, but maybe can dovetail back into others' thoughts. I remember at one point we exhibited this, in a different exhibition, someone challenged us about the question between the role of art, activism, and propaganda. Kind of what's the difference? And I think this kind of, it relates to some of the challenges about, fighting misinformation, because on the one hand, people get resistant, I think, when they're told what to think, in a sense, right? There's a kind of pushback. So how do you be bold, but at the same time invite? You get the kind of paradox on, yeah.
Yeah, I do. And I mean, I'm aware when we're talking about social media, for example, I'm certainly aware here in the UK, where I currently am, of some really big projects that have been undertaken by, let's say, creatives, not necessarily artists in the visual artist sense, but there've been a couple of big projects, #TakeTheVaccine, which was undertaken by prominent BAME media personalities, which was shown on television and certainly circulated through other social media, encouraging BAME groups, urging them to take COVID vaccine in a TV campaign. Another, Lenny Henry, well-known comedian, did another project called Letter to Black Britons that was, again, these were projects that were attempting to reach millions of people to encourage communities where there was a higher rate of resistance. And I really noticed in that just the language that was being used. The Letter to Black Britons was really being connected to Black Lives Matter, using words like vaccine cautious instead of vaccine hesitant to make it not sound quite so sort of negative in a way, and a bit more kind of empathetic to certain points of view. And because these projects were played out in social media, you instantly then see all the responses to them, and some very harsh responses, with people saying that they found this really, just some really negative responses to, as you say, to sort of don't tell us what to do, those kinds of things. And it was painful to read all that and to see those things played out in social media.
Yeah, and that's a nice segue to another question I wanted to, kind of for everyone, is when you take on the role of trying to tackle misinformation, there can be this pretty brutal backlash, particularly for people that are in the public. And this is becoming a huge issue in itself. And it's a touchy topic, but Susy, do you have any thoughts on this and how to kind of deal with that as a public figure?
It's definitely a problem, and it's a growing problem. And especially, I think, as people are becoming more and more fed up with, the situation they find themselves in, they need an outlet, I think, to kind of voice that. And so, yes, when you do decide to be a communicator publicly, you are opening yourself up to all kinds of backlash. And that can range from incivility to harassment to, some people being afraid for their safety. And so What do we do about that? I think it's really just, to me, syndromic of or symptomatic of what's happening in greater society, and how recognizing that we need to support each other better. I do find that I've actually chosen to do more conventional media rather than tackling some of this misinformation and some of these issues on social media. And the reason being, deliberately, I want people to see a face. I think it's a lot harder to attack somebody personally or to get sidetracked by, just the personal view when you see the face, and when you can have a dialogue, that's even better. So trying to talk to people and get feedback and have a conversation is another effective way to try and, deal with the misinformation issues. But also, I think, maybe I'm wrong, I'll see over time, it may be a way that you can avoid some of that backlash from really escalating, because you're a person, you're there in front of them. You're not a bot, you're not, some nameless, faceless person on a computer or a device. So that's just a few thoughts, but it is a growing problem, and it worries me, because how are we going to get future generations of science communicators and communicators out there if they start to see these consequences being very real?
Yeah, absolutely. David, do you have thoughts on this?
Yeah, I'd love to jump in, and I just want to build on a little bit on Susy's comment. We've certainly seen that the health professionals are finding it challenging, and sometimes simply sending out information to our patients has resulted in quite significant backlash. One of the initiatives that we developed in our department alongside the McMaster Museum of Art was called the Art of Seeing. It was developed by one of our full-time faculty along with an art educator at the museum. And what it was trying to do was enable our students and our physicians and other health professionals to start to see the world from other people's point of view. In other words, developing a deeper sense of empathy. And as we're starting to have these conversations with the vaccine cautious or the vaccine hesitant, or even the anti-vaxxers, it's trying to understand where they are coming from and to approach it perhaps from their point of view. Because it's clear that just hammering the same old message isn't going to work. And there's no question that if you use social media, or people look at social media, they receive the information. I don't think most people make the decisions to vaccinate or not to vaccinate in a vacuum. They tend to talk to their friends, to people that they know who are physicians or people or scientists or whatever. And that is our role as healthcare providers, is when we have patients or friends or colleagues, is to try and be able to give that consistent message, to be humble about it. We don't know all the answers. Here's where this thinking is today. Here's what we think we know. And this is why we have chosen to either get vaccinated or have our children vaccinated, whatever that the message is. And to try to give that information to them without doing it in a judgmental fashion. And it's really that understanding, that empathy, and I think that's where the art is such a wonderful, creative way of giving the message, maybe a little bit differently, and perhaps in a more intangible way that gets to emotions as opposed to just the facts, because oftentimes we make decisions based on emotions, not just straight facts.
Yeah, absolutely.
Can I comment on this?
Yeah, please do, Tim.
Yeah, I mean, this is a really important topic, and I think it's worth reflecting on it. A study came out recently that found that 15% was published in Nature. 15% of science communicators in this sphere have received death threats. I've received death threats. I'm in the middle of a lawsuit, and anti-vaxxers suing me right now. People lie about me on social media. Constant harassments, daily harassments. 91% of prominent science communicators have been involved in abusive behavior, and it's worse for women and people of color, right? This is a huge problem. And so Susy's comment I thought was interesting, and I totally agree with her. But at the same time, the fact that she's decided to go off social media, that's a win for those pushing misinformation, right? That's a win. They've made you feel uncomfortable and they've made you leave, and that's their goal. So what we need to do, we need to create systems that support those who are fighting misinformation. So that means creating communities where people feel comfortable getting on social media, having institutions rewarding people who fight misinformation. This isn't something you do off the side of your desk. This is science communication that needs to be rewarded by your employers. We also need to have legal support for these individuals so they don't fear getting on social media and countering misinformation. You know, Susie, I gotta admit, I feel hesitant sometimes. And every time I can, is this going to piss someone off? I can feel that at the back of my mind, and that is them winning. That's them winning, right? Because that's exactly what their goal is. So we need to create support. And going to what David said, we should come back to this because I think it should be one of the key messages of this panel. Art is an entry point that really invites different perspectives, right? And I think it's one of the reasons why it's so valuable. And there's research to back that up, Sean. We can come back to that later. But it's not just this, academic activity. Art really can make a difference because people come to it, I think, in a more open, neutral manner. And it's a place where you can have these conversations, perhaps, as Susie and both David said, where you don't have such you don't start from a perspective of polarization.
Yeah. No, it's great points that are being made. And of course, there's a couple of pieces in the exhibition. I'm thinking of conversations with vaccine hesitant parents and Shadowpox that really tried to look at this question through art. And I think they're interesting pieces because I think both as a viewer or audience member experiencing the piece, there's a kind of different entry point into these questions. But I also think as a method that might be adopted, like using creative activity as a way to engage people is interesting to think about too. The challenge, of course, is it maybe doesn't have the reach of social media, right? So that's, but nonetheless, it can play an important role. I see you nodding. Rachelle, did you have something you wanted to add there?
No, I was just sort of generally agreeing with everything you were saying, and I was just sort of reflecting back on some of the pieces. Yeah, but I think as the point that's been made, that it enabled so many different kinds of conversation to sort of happen, where you can kind of nibble around the edge of things and come at it through a different tonality than the sort of other kinds of messaging. But I mean, the other thing that I was just sort of reflecting on, I suppose, as part of this conversation. And again, I suppose it's to do with misinformation and how this is so problematic in this sphere that we're talking about, but in so many other spheres of our lives right now as well. And I think one of the challenges that we've had in the UK context is that the pandemic came on the back of Brexit. And, and I mentioned that particularly because there was another, kind of catastrophe of misinformation, but also that really divided society into us and them. Everybody was on one side or another of an argument to the point where people didn't want to talk. And I think in this context, it has made it a bit more difficult to engage, to sort of ask people like, so, what's your take on this particular subject? Because, we've been a bit kind of chilled into the trauma of what it is to be in an us and them society and maybe not talk about it so much.
Yeah, on a kind of day-to-day basis, right? Yeah, absolutely. Great. So we're coming to a bit of a transition. I want to start taking questions from the audience, and I'll maybe just dive in on some of those. The first one we've sort of touched on already, but I think it's an interesting point in terms of our, the season we're in. And they're asking, would any of the panelists be willing to comment on the impact misinformation can have when it's originating from health professionals, perceived scientific experts? What can be done about this? And we touched on this a little bit, but Susan, do you have thoughts on this?
Misinformation coming from experts has been one of the most mind-boggling parts of the last 20 months, in my view. And Rachelle said earlier that she was surprised in her piece for the art exhibit because she came into it kind of thinking that everybody was on the same page, and it turns out that's not the case. And so I think for me, that's been a bit of a shocking revelation as well. I thought that public health folks kind of all came into a pandemic with a bit of the same approach. And so it's surprising to find out that's not true. I'm not entirely sure what we can do about actually trying to redress that problem. One of the great things about being in science is that there are a diversity of opinions, and usually that leads to better science. We've hit up against the case where that doesn't. And we've also hit up against places where people are willing to commit actual fraud to get their political viewpoints about COVID across. I don't have good solutions for that. I hope that we amplify the voices who are actually speaking to some of that. I see Tim's waving his hand, so maybe he has better solutions than I do.
Can I go ahead and comment?
Yeah, please do. Yeah.
I totally agree with you, Susan. This is one of the most frustrating issues and one of the most challenging to deal with, because you don't want to be seen as silencing individuals. But when a health professional or a scientist is spreading what is clearly misinformation, and that is happening, I think the regulators need to step up. So in Canada, that's the College of Physicians and Surgeons. In the United States, that's the licensing bodies. In the UK, the same thing. They need to step up and they need to silence them. And I'm frustrated. Look, I know it's complex and there's resource issues, but this is why they exist. Regulators, this is your moment. This is why you exist. This is, you're legislatively required to put the best interest of the public first, right? You're not an association that's supposed to promote your members. Your goal is to protect the public. So College of Physicians and Surgeons, step up and silence those members or sanction those members who are spreading misinformation. That's your role. The other thing that we can do, and we're seeing this happen, is let's say you're a scientist, you're not a regulated health professional. I think other members of the community can speak up and say, hey, this is actually a fringe view. I know they seem like they are experts in this field and they come from these really respected institutions, but their view is fringe. This is the body of evidence. This is the scientific consensus. And we've seen that strategy work with climate change. We've seen it work with fluoride. There has been research that suggests it'll work with vaccines also. And we've seen that play out in the context of the Great Barrington Declaration. Remember that? Where you had other people say, hey, they may come from respected institutions. This is a fringe view. What you want to avoid is that false balance perspective, which sometimes the media can do. We actually have a study coming out right away on false balance in the context of natural immunity. But those are just two strategies I think that we need to see more of, and I think they can make a difference.
Yeah.
Can I make a quick comment as well? Is that, yeah. Yeah, so I just, maybe this is a bit unrealistic, but I kind of think, especially with social media where it's not really regulated what people can say, some of the onus does also fall on the consumers of that information to really kind of look a little bit more deeply at a few things. The person who's speaking or putting out a view, do they have any obvious political affiliations? Are they, disproportionately setting out messages that are about self-promotion or have some kind of, tone or undertone of self-promotion? And do they have any obvious conflicts of interest? Now that takes time and energy to do, but at some point, I think this is going to be an important way that we try to evaluate the quality of what we're seeing on forums like social media, where you don't have any regulation of what people actually say. So that's just another view that I've been kind of contemplating as well, is some of it's up to us.
Yeah. David, you had a thought as well?
Yeah, and I think it's really important to emphasize what Susan said, and there's a difference between scientists debating the facts and debating the findings versus spreading misinformation. And I think that is a really, really important key. And Tim, just to reassure you, we've had examples of folks trying to spread the misinformation and utilizing their title as a member of our university, and us having to take that away and say, we are no longer able to give you students, and we can no longer have you claiming that you are a whatever in our department. Just It's not, you've crossed the line. And it's a real challenge as an administrator and a leader in that, to say you're definitely over the line versus you're pushing the line. And oftentimes folks push the line, but I think you're absolutely right that it is up to institutions such as ours and the University of Toronto and Alberta, et cetera, as well as the regulatory colleges, to call it out when it is clearly way over the line and can create harm. And that is one of the real, I think, issues, is when it's promoting treatments or things that would create harm to individuals.
Oh, absolutely. Just a reminder, if you have questions, please put it in the chat, and that's how we'll sort of respond to things to everyone in the audience. I have a question that's directed towards Tim, but everyone could certainly chime in. And I think it maybe links into what we were just talking about in terms of politics and ideology. What is the link between fetal stem cell research and vaccine development research? So a bit outside of our topic, but certainly related.
Yeah, Sean, I don't think it is outside of our topic, because it is misinformation, and it is something that we're seeing a lot right now. But as all the experts on this panel know, this is a narrative that has been around for a very long time, and there's a reason for that. So first, real quickly, the facts. Yes, decades ago, fetal cells were used, for initial research to create cell lines, to do research on some vaccines. There are no fetal material in the current vaccines that are being none, zero. Okay, so I think that's important to recognize. But the reason it keeps coming up, and why I think it's so relevant to this panel, is you touched on it in your segue to the question. It's ideology, right? What they're trying to do is create a reason not to get the vaccines. And so we're seeing it emerge, for example, in the context of people trying to get religious exemptions, or however that's going to be, non-medical exemptions, I'll put it that way, and using this as a justification. And it just doesn't hold water. And I think it's also important to recognize that all of the major religions have sanctioned or endorsed and encouraged the use of these vaccines. Yes, there are some smaller religions that have, for reasons that have been institutionalized for a long time, that may have objections to it, but you can't just roll out this theoretical concern and as a justified reason for a non-medical exemption. And I think that's one of the reasons why this concern persists. And of course, the other thing it does is it leverages the incredible abortion lobby in especially jurisdictions like the United States, but really around the world. So I think that's why you see that false narrative rolled out again and again, because anti-vaxxers know it can have tremendous sway.
Any of the other panelists want to chime in on this particular?
David, do you want to comment on the science? I hope I reflected it well.
Yeah, I don't think I've got anything to add, Tim. You hit the nail on the head. It's it blows my mind that folks would use that kind of linkage at this point when it's just so far from the truth.
Yeah. Okay, great. Well, I'll just maybe transition to another question here, and I think Rachelle, you were kind of touching on this a little bit, and it's a tricky one, and I think something maybe we've all, to a certain extent, experienced in our own lives. My friend is vaccine hesitant, and as much as I love them, I've reached a point where I'm no longer engaging in the subject. I'm tired. We're all tired. What do you think the responsibility is to try to reach them? Tough question, but an interesting one. I'm not sure who to ask for that one. Anyone want to jump in? Or the silence? Who should I pick on? Susan, do you have thoughts?
You know what, I would go back to what David was saying earlier about how these decisions, they don't get made on social media. These are decisions that get made more locally. And so as tired as you may be, as tired as we all are at this point, we do know that those conversations that happen between loved ones, within communities, closer to home, those are the conversations that really end up actually getting through and impacting people. I mean, I applaud everybody who is still having these conversations day in and day out. I applaud, folks like Ottawa Public Health, who very close to home are able to bring all of this great information together. There's a world of bad opinions on the internet, but closer to home is where people are going to actually make their decisions.
Yeah, great.
And look, in what we teach our learners in family medicine is let's take it away and move to smoking and anti-smoking and stopping smoking. You ask your patient, are you ready to have the conversation about stopping smoking? And they tell you no. And you see them a month later or six weeks later, and you ask them again, and they say no. No judgment. You just move on to the reason that they're there. And usually, eventually at some point, they'll say, yeah, you're right. I've been thinking about this. My friends are nagging me. I do need to do something about this. What do you have to offer? And then you end up having that conversation. So I think it's the same with the vaccine cautious or vaccine hesitant, that being relaxed about it and giving them the opportunity to have the conversation on repeated times is probably where it's at. Going at them really hard and saying you have to stop smoking, or you can't, you've got to get vaccinated, probably isn't going to be effective. That doesn't say though, and this was a conversation we had this morning around the nurses station, is okay, my sister has children who aren't vaccinated, and do we allow them to come at Christmas? That ends up being a conversation that you have to have in your own family, in your own judgments and your own values, and make that decision. But that's a really tough one in that context.
Yeah, absolutely.
I think one of the sorts of conversations that we were really tried to tease out in the Vaccine Nations project that we made was because we had so many students involved in the project from so many different countries. We were able to have some really interesting conversations about the differences between the choice that some people have in some contexts versus the profound lack of availability for some students in other contexts, and also the extreme gratefulness that students from some countries had that they had the availability to be vaccinated, and being able to come at that for students who have been able to experience all of those different points of view that have come from different geographic realities. I think it was a very poignant experience for a lot of the people involved.
Yeah, and I was going to say it's an interesting thing because it's a lot. I mean, what David was talking about was patience and time, right? In a sense, but of course there's urgency. So this is again the challenge we face. Tim, it looked like you had something to contribute there, or?
Look, I agree with everything my panelists said. They really hit it on the nail on the head, as David said earlier. But it's about empathy. It's about listening. It's about finding common ground with someone you're talking to. And there's actually research that highlight that, we're all want to take care of our family. We're all frustrated with the uncertainty. Find that common ground. Someone said this earlier, I think maybe it was you, Susan, tell them why you got vaccinated and have that story. These stories matter. And then, yes, you point them in the direction of credible information. And we have a great list of credible sources on Science Up First that you can point them to. People don't change their mind in front of you, right, David? They don't go, David, now that you mention it, you're right. That never happens, right? That never happens. So you want to give them this path to credible information. You want to be patient. Sean, you know this. Johan, my wife, she's a family doc, David, and she has the exact same stories that you just said. She just tries to be patient, keeps bringing it up, and then it happens. And sometimes they do it, grudgingly, right? Oh, I got the vaccine. But those success stories happen. These conversations matter a whole bunch.
So a question that I think really related to what we're just talking about, and one that we hear a lot, but I think it's a good thing to think through. I have heard from a few vaccine hesitant people I know that they have strong mistrust of the profit motives of multinational drug companies as a result of huge profits. Why do we hear so little directly from the corporate sector representatives on this topic? So it's a good one. Susie, do you have any thoughts on this?
It is a tough one, right? Because inherently, I mean, there's going to be a relationship between the big pharma that's manufacturing these vaccines and then, you know, what we end up having to do to try and manage this pandemic. I mean, I do think over time, I felt as though the pharmaceutical industry has been honest and open about what's happening with their products. I think they recognize this is a public health emergency that we all just need to try and tackle together. And so, you know, that helps. Where it starts to get tricky is if, you know, results of trials end up being modified, you know, interim results are being shared a little bit too early. And, you know, lo and behold, the final analysis shows a different outcome from what people are expected. But, you know, that information's out. The damage, so to speak, has been done. The persuasion's been done. That's bad. I mean, that's going to undermine confidence in general. But it is an important aspect for us to acknowledge. I think whenever talking about new and emerging data around vaccines or therapeutics with this pandemic, I'm always very cautious to say these are preliminary results. These were released by press release. They are in preprint. They're not peer reviewed. You know, what the state of the data is, I think that's one way we can try to help people understand, like, this is what we know. I'm going to speak about it and try and put it into context so that I can help you make a decision around this. But it's preliminary. And these are the shortcomings of the limitations. And that's all I can really say about that. I don't know if others have opinions about it. It's very complicated. We are dependent on pharmaceutical companies to do the research.
Yeah. Any other thoughts on this particular?
I think the other thing you can do is you can remind, I totally agree with what Susie said. And I think that you can remind people that independent bodies review the data, and they do it recognizing where the data came from. And we've had that happen with these vaccines all across the world, right? Independent regulatory bodies reviewing the available data. In addition to that, there has been a lot of independent research on the validity and the power of these vaccines. So totally independent of big pharma. And the other thing I think people need to remember is anti-vaxxers are trying to leverage that inherent distrust for industry, which is understandable. You know, we do research actually on the impact of commercialization on both the research and how research is represented. So I totally understand and sympathize that concern. But remember that those who are trying to create doubt, those who are doubt mongering and fear mongering, are trying to use that. They're leveraging that fear to create the hesitancy. So again, I always go back and I said before, you know, think big picture, right? Think big picture and what the body of evidence really says about these vaccines. Yeah,
it's such an interesting point, and of course it makes me think about the challenge of even reporting, where some of this more really nuanced information is buried deeper in the article or deeper in the story, and people just don't get to it, right? So even how it's presented is a real challenge, right? We have some more art-related questions. The arts and creativity have the same challenge. Conspiracy theories are a form of storytelling, turning real people into fictional characters. Using creativity to make misinformation sticky and shareable. What do people think about this aspect of the arts? And maybe Rachelle, I'll turn to you. That's an interesting question, yeah.
No, I think that's a really excellent question. And I think that indeed, as the person who's submitted the question there is sort of alludes to, art and creativity, we're also incredibly agile with our methods. That I think the exhibition currently at McMaster will, that there's so many different ways of making art. So that, I mean, in terms of moving image and using social media and installation. I mean, there are just so many different ways, and there's a lot of tools in the toolkit. And, you know, so I think exactly as the question is there, that it can be, you know, it can be, the message can go in all kinds of different sorts of ways. So I think, I mean, my point of view is really about going back to the source, as it were, going back to, you know, how we design art and design education. You know, how do we train artists and designers to be critical thinkers, to understand the idea of evidence-based thinking, to have that really dynamic understanding of media literacy. You know, how do we design people's educations so that they are not just good at the communicating and the creative part, but they are also really rooted in you know, being able to think through things in really kind of rational ways, and understand how different ways of understanding knowledge, scientific thinking, you know, other kind of ways of looking at the world, so that they really do kind of get the bigger picture thinking and don't get deviated off into, you know, the kind of storytelling which, as you say, can help to contribute to some really difficult things.
Yeah, I mean, the point you bring up is so good, and it makes me think of a bigger issue. It's probably another panel discussion of, in a way, are we putting out fires? And in a sense, is this a, you know, like, we need well-educated, creative, innovative societies. That's how we respond to this stuff. And if you're, you know, trying to fight a pandemic, but meantime, and I'm talking from my own jurisdiction here, cutting post-secondary education, you know, ultimately you're going to lose the battle in a sense, right? Because you don't have a well-educated population. That's a little kind of my rant there, but yeah. So another, I just had another art question. So I'd like to hear from the non-artists how thinking with the art, about art, has impacted their practice as scientists. I'm not sure, I mean, some of you have kind of collaborated. Does anyone want to jump in on that question, Tim or Susan?
I found the opportunity to collaborate as part of this project really exciting. So I was part of the team that helped put together the Shadowpox piece, and it's virtual reality, right? You're engaging in real time with trying to wipe viruses off of you, and it's making a strong point about vaccine rates and equity around the world. And I found it, even as something that I think about every day, you know, I think about these questions in a very scientific way, engaging with it in the real world still brought something new to something I think about every day. And so I thought it was just a phenomenal way to create interdisciplinary collaboration.
Yeah.
Yeah, I'll comment on that too, Sean. You know, we've done numerous projects working with scientists, right? With genomic scientists, with stem cell researchers, and it was fascinating to watch their interaction with the artistic community, right? It really was. And, you know, sometimes it was heated, and it was partly around, we've all talked about this, the uncertainty and how to represent uncertainty. That was, I think, was that our first one? You can see the cover of the book back there, Imagining Science. And it was fascinating to see how the scientists got frustrated with the artists for their lack of certainty in their language. Am I being fair saying that? I want to make sure I'm not mischaracterizing what I observed. But then at the end, they were all kind of at the same place, recognizing how important it is to engage the community in a way that is going to have an impact. And, you know, I found that tremendously exciting. And the other thing that, for the scientists more on the panel, the other thing I found fascinating, Sean, was how everyone came to the realization that people start kind of from the same place. This is about creativity. The scientists are trying to be creative. They're using different methods. There was this sort of harmony in the approach and the passion that they brought to the topic. They're just kind of using different methods.
Yeah. No, it's a great point. And actually it links to a note from one of the participants of the project. It says, I totally agree with the importance and power of art in communicating about vaccines. Art's having a subtlety and elegance of doubt and diversity. But however, in the natural science way of communicating, we should emphasize more about the beauty of simulating natural processes. So I think he's sort of suggesting what you are, that there's a creativity in the that's not that different really. And perhaps that's a strategy for science communication. Yeah. We have talked about some difficult things, and there is a note here that's very positive, and I want to share it. It's to Susy. Thank you, Dr. Hota, for taking the time to be here today and on the National. I love tuning in to hear your perspective. You're so well spoken and provide important message thoughts. You're an important mentor and role model too. So that's nice to hear. We've heard lots of negative things, but people are also supportive, right? Yeah, and I hope that's happening to others on the panel who are in the public realm. We're coming kind of near the end here, and have a question about, as we're coming into the holiday season with family who are against vaccines, and I think we touched on this a little bit. How can we justify the importance of vaccination, especially as the pandemic has continued and cases have increased? Any simple, impactful tips? I suppose in some ways we've talked about this, patience. I think the point that David made earlier was that some of those conversations are with people that are very close to you, right? Any additional thoughts on that question?
The only thing I would add is it's so important to talk about these things, but if you start to feel your face getting red and the emotions really take over, it's time to back away. I mean, these are complex issues, and relationships are so important, And so if that happens, maybe you can stop it there, think about coming back to it later, the conversation later, or engaging the help of somebody else who you trust, who you think might be able to do it with a slight impartiality. It's easier when you're a physician and you've got a patient. There's a relationship there, and you take that step backwards. But when you're talking about your family members and your friends and the people you care about, sometimes it's really hard to separate out your emotional response from what you want to try and convey. So I just wanted to make that comment too. There is a time to step away from it, and maybe ask for help for somebody else to talk to somebody.
Yeah, I think that's a great point.
John, I think the other point is it's often not an all or none. So if I really want my extended family to come and join us, or I'd like to see them over the holidays, but I'm not comfortable at having them in my house and having dinner with them, there's opportunities to go for a walk outside where it's safer. There are different ways of addressing it. And I think it's really important to understand what your own bottom line is, that you and your family's comfort or level of comfort is, and then to make accommodations from there. And it really is about you being comfortable, not necessarily having to 100% accommodate other members of your family who might have different beliefs than you do. And in this situation, you can agree not to talk about politics around the table. Unfortunately, viruses don't care. They're going to cross across the table, and that can have real significant impact on your health. So that's a matter of trying to ensure that the safety of where you are living.
Yeah, absolutely.
Yeah. If I can just jump in and say quickly that caution is warranted. From an epidemiological point of view, the holidays are a little different. People move around a little more. They're outside of their usual bubbles. People travel a little further. And so even if you have a good sense of how safe your community close to home is, that all starts to change when people start to move around a lot more. And so then I think you do have to just respect the decisions that people in your family are making. And everybody's risk tolerance is different. And so, if over the holidays you hear that a family member that you might like to see or has decided that they're not going to see people, you just have to respect that ultimately, because the whole dynamic just changes a little bit the more that people start to move around.
Yeah, so that's some great thoughts. We have just 10 minutes left, and I've been thinking, we're having this great conversation, but of course it was an exhibition. And Rachelle, I was thinking, just to maybe wrap up, it would be wonderful to see the work you produced as a kind of closing to the conversation. Would you be willing to share that? That'd be great.
Yeah.
And maybe talk us through it a bit.
Yeah, okay. I've got a few slides here that I can put up. So so this is our contribution to vaccinations, and we start here with just a selection of some of the posters that some of the students made, and you can see that students came at this in very different kinds of imagery, and they had done a lot of research themselves into different kinds of vaccinations and the challenges within their home context. So this is a project led by myself and my collaborator Mkrtich Tonoyan, who I think is part of the audience listening in today. And so as part of Immunations, we were really trying to approach this in this dialogue-based, socially engaged way, and trying to think about that boundary between art and education, which is why we were working very much as the participants in the project were students that myself and, as I mentioned, Sean and our colleague Patrick and others were working with, to get them to think about the question that we were all asking, but to ask the students the same question, to look at the role that creative practice can play in challenging vaccine hesitancy. So these are just some of from the first exhibition that we had at Gallery Kit in Trondheim in Norway. So a number of the universities involved listed up there, and some of the images that were made. And so we just put all of them up in a big display of the posters around the room. And a lot of the colleagues who came on the first night were from the vaccines conference that happened on our opening night. What was the name of that conference, Sean? Was it GlobeVac?
I believe so. Yes. I can't remember.
Yeah, so I mean, it was great because, of course, the audience for this then were people who knew a lot more than we did, of course, about the science and the implications of the work that the students were doing. So again, these are just a few of them with the names of the students who produced these particular pieces. These are just some of my favorites, really, because I thought that they had really punchy, fantastic visuals. Some of the students in Coventry were with a group of MA graphic design students. I was previously at Coventry University, and they started working together in groups to make zines. So this was really about how they could, use a really popular creative format to think about little nuggets that could move out, the kind of distributed works that people could take away and take out of the gallery. So a very different kind of approach to gallery pieces. And we also worked with a couple of professional artists. This was another zine made by an artist, John Hammersley, who performed a dialogue about vaccination with a doctor. And so it's kind of like a very, a transcript of the conversation about vaccination, and another one that told a very different kind of story about someone who had suffered from polio, who hadn't been able to be vaccinated. And so here is just in Trondheim, this is in Geneva, of how we displayed a lot of these small zines, and as I said, people could just take them away with them. The big zine we made, this is part of the exhibition at McMaster. And so we put a lot of those large posters into this large format to make this very big format zine. And the idea really was, talking about skin in the game, that you had to use your own body. So it's kind of implicating yourself or the audience's body within the work. So a lot of images there of the different pages within the big zine. And for the building in Geneva at UNAIDS, we also made these quite fantastic window graphics. These works were designed to be quite site specific. The UNAIDS building in Geneva is incredible and, you know, all very glass filled. So we wanted to be able to use that site to be able to explore these different kinds of images. And I think this is the last one. This is our beautiful big bunny with the carrot made into a vaccine. And so this is also just, you know, again, the more playful way in which art can contribute to the conversation, coming at this from a very different sort of perspective, using this kind of playful imagery, slightly surreal, bit odd, but you do have that bunny behind you there, Tim. So it's kind of from bunny to bunny. Yeah, so there's just a little taster there of some of the works that we made with students as part of this broader conversation of immunations.
Great, thanks for sharing that. And I think that was a great way to wrap up our discussion. So just to end, I want to say there will be a publication coming out about the Immunations project. It's currently in production. So if this is something that you know, was of interest to you, please look for that. Otherwise, I would just want to extend a huge thanks to all the panelists. Again, I know you're all very busy, and for those panelists that came in last minute, double thanks for that. And yeah, I think it was a great conversation, difficult topic, and certainly one that we need to keep happening. So any final words for anyone? I welcome it, but otherwise, thanks so much, everyone.
Thank you, it was great.
Yeah.
Thank you very much.